We've been in a state of crisis for weeks due to the pandemic, and prolonged periods like this can lead to mental health issues like depression and increased anxiety. Today on Central Florida Spotlight, some of the top mental health professionals in the area help provide advice and let you know where you can get help. Hi, folks, and welcome to this week's Central Florida Spotlight and a discussion with a group of mental health experts, all joining me to discuss how to manage the fears and anxieties that are obviously brought on by the coronavirus pandemic. And my first guest today is Dr. Louise G. Allen, Medical Director at the Advent Health Center for Behavioral Health. And I want to thank you for taking some time out of this busy time for people, especially in the health industry, whether that's the physical or the mental health. And Dr. Allen, we've had you on Channel 9 before, and since then, are you seeing an increase in folks seeking help for mental health issues that maybe they haven't had before now?
Yes, it seems that the first phase we're hearing more of the health conditions related to this pandemic, but we have noticed now that there has been more of a mental health needs in regards to symptoms of anxiety, symptoms of depression that we're currently seeing that patients are coming to seek help.
So patients that may or may not have sought mental health assistance now are feeling overwhelmed, and they may reach for something and self-medicate. Obviously, that's not what you would advise. What would you say to somebody who before now has never thought the need to reach out to the mental health field?
One of the things that I consider to be very important is to make sure that we are being very mindful and careful of monitoring our what we call neurovegetative symptoms, our sleeping habits, our eating habits, making sure that we don't utilize substances like alcohol as a way of coping with current symptoms of anxiety. So it is very important that we be very mindful of these what we call basic function of life.
So if someone's starting to feel this anxiousness and they say, I can tough it out, I can make it through, are there some warning signs there that maybe it is too much, maybe the pail is too full and it's starting to spill out?
The first one that starts to give indication that there is a problem and it's changes in your sleeping habit. And this is difficulty falling asleep, staying asleep, or waking up early. If there are changes with eating habits also, and also a change in mood. If you notice that you're a little bit more irritable than before, more argumentative, being more short with others, then we're probably starting to see some changes that you need to be very mindful of.
So what are the factors that can bring some of those issues about? Is it the losing a job, being ordered to stay inside, isolation, fears of contracting the virus? What is there a number one element that's impacting people mentally?
At this point, at this stage, probably what we're seeing, the number one at the top of the list is the social distancing, the social isolation that patients are experiencing. We are slowly starting to see the impact that financially some patients are experiencing, be it by the patient itself or their spouse or a loved one. But yes, the first change as it relates to that social distancing, we are starting to see some of the impact that can have.
So you talked about the symptoms of underlying mental health issues. Does someone need to be fearful that what they are now experiencing in terms of their mental health, their mood, is going to be permanent scarring that's going to lead to this? Or will we come out of this once the coronavirus and COVID-19 start to be eradicated, whether that's through time or through a vaccine? What's your take on that?
We will get out of this and come out ahead and probably even stronger. But it's very important for us to be very mindful of these changes in behavior that someone can be experiencing, changes in sleeping habit that someone can be experiencing to avoid having those permanent scars, as you mentioned.
So are there some resources that are readily available for people through Advent Health and your department with behavioral health?
With Advent Health, we currently our emergency rooms and including our freestanding emergency room, we have a telemedicine service, and this is provided 24/7. In addition to that, we have a Outlook clinic that is a community a clinic for the uninsured, and there are some very specific criteria for that clinic. And this clinic is primarily someone needs to have a comorbid medical condition, be it high blood pressure, diabetes, some other medical condition in order to be part of that clinic. And then a resource that we partner with is the Mental Health Association, and they have virtual groups that they have created.
And we'll be talking with Mental Health Association coming up in just a segment or two here on Channel 9. Dr. Allen, what about mental health issues specific to seniors during a time like this, and what are those warning signs?
The seniors are at a very high risk, we know, for the virus itself, but also as it relates to the issue of isolation. And the primary symptoms that we can expect from seniors, and we have been seeing some of our seniors, is primarily with panic disorder, panic attack, and also symptoms of depression that sometimes can lead to a sense of helplessness, hopelessness, and at times even experiencing suicidal thoughts.
Yeah, I know it's so sad for those, especially those that are in the healthcare system where they're being distanced just for their own safety. What about healthcare workers? Are they experiencing particular stress and issues due to their work right now, or has this come with the territory and they're well prepared mentally and physically to handle it?
For healthcare worker, like with anyone else, their world has changed. Even in their day-to-day work patterns. So for some, their shift, if there are changes with shifts, changes with sleeping patterns, they are seeing the impact that is happening with their loved one. All of this create additional stressor for that individual because they are human and they have families and they are experiencing a lot of what they are hearing and seeing on the news because they are at the front line. So that's the reason why we have to be very mindful of the healthcare workers for us to understand that we are part of that vulnerable population, and it's very important to be mindful of our eating habits, exercising, taking care of those basic things in life.
Could the homeless be more susceptible as well to mental health issues? Many of the people that are on our streets have been diagnosed with mental illness by researchers who have walked among them. And I would imagine that this is even a more stressful time for those folks who don't have a roof over their head or a support system.
Yes, there is one of the theories that they call it a downward drift. Sometimes individuals that have a mental health condition, because of so many events throughout their life and difficulty in relationship, they end up being homeless. And yes, this population is definitely at a higher risk without any protection, without any support system in place.
Very good. We appreciate your time, your expertise. People can reach out to you. We're going to continue this important discussion over these next several segments. Thank you to you, Dr. Louise Allen, and all the people that you surround yourself with as you help all of us get through it. And I loved, most importantly, that we will get through it and we will be stronger. Is that a promise?
Yes, it will happen.
All right, good. Good to hear from the experts. All right, up next, a leader with Aspire Health Partners, another local group well suited to provide counseling and therapy for those who might be struggling right now. We'll hear from that expert after the break. Welcome back to Central Florida Spotlight. My next guest is Babette Hankey, President and Chief Executive Officer of Aspire Health Partners. I want to thank her for joining us today as we continue our social distancing. Again, talking to us via Skype. And Aspire has 25 campuses throughout Brevard, Lake, Orange, Osceola, and Seminole counties, providing treatment and recovery services for individuals and families. And I would imagine that you have a very busy phone line, if people can even get through, regarding the anxiety as a result of COVID-19. Are you feeling the impacts in terms of volume of calls and volume of people needing help?
We absolutely are. In fact, we've established a separate line specific to those with anxiety and depression or needing other services related to COVID-19. So direct calls coming in with over 200 professionals. You can call in to 407-875-3700 and push 2, and someone will be there to help you at any time. Our calls have increased by over 30%, and that's why we need to dedicate the line.
As a follow-up to that question, Babette, when it comes to anxiety, COVID-19, that seems like, hand in glove. Is there any simple thing that I can do where I don't have to seek professional help if I feel overwhelmed?
The very first thing, Greg, is to practice self-care. Establish a plan for yourself that you can actually control and take control of. Make sure that you're staying informed, but you're also taking time where you're getting outside, you're doing activities, and you're normalizing your schedule to the extent of a normal schedule can be. That is really important as you continue to move forward and to reduce your anxiety levels.
People like to be around people for the most part, so how can I continue with my social supports when group activities are non-existent? I know that we're doing this via Skype or Zoom or whatever technology this is, but it doesn't feel the same. While I can see you and talk to you, it doesn't feel like the same kind of relationship if there was a group setting.
You are so right. The social connectedness, however, is extremely important, where you schedule different times to be able to still stay in contact with family, with places that you like to go to, with friends. We all have to remember we're really into physical distancing, but social connectedness. That is what is going to continue to keep our minds healthy, as well as being able to exercise to keep your body healthy, and then spiritually to keep your soul healthy.
I've seen people, I live in the Lake Baldwin area, and they sit like in a triangle area even, so they're 6 feet apart, they're getting fresh air, they're getting caught up, and that seems to work for a lot of folks right now. Would you agree?
Absolutely. It's really important, and to schedule that, because that does let you start to de-stress and know that you have something to look forward to that is your new norm. It normalizes the activities that we once knew into how we're going to do it in the future.
Kids are afraid that they will fall behind in school and that they will have no friends. How should a parent or a guardian or a loved one comfort the youngsters?
Well, we first have to remember that children are not adults in little bodies. Children relate differently. They take in things differently. The most important thing is to let them know that it's safe and that we're here, everybody's here to provide guidance, loving support, and involve them in the different activities that we're going to be doing. Let them start to take the lead on things as they move forward, and also establish structure. Our children are so used to structure, they're used to school, they're used to homework. They still need structure to be able to cope appropriately.
So most everything has been focused on physical health, of course, Babette, which is understandable. What do you think about the mental health concerns as well? And not just worry and fear, but it has gone to the point of alcohol abuse, substance abuse, and Sheriff John Mina said, unfortunately, suicide as well.
Yes, Greg, we're seeing increases in need of services for mental health and for addiction services, very similar to what we saw after 9/11, as well as after our Pulse tragedy, and then hurricanes. The post-trauma that comes after different events, very similar to this pandemic, are those that are in need of resources. However, I believe we can get ahead of it. If we start focusing on the mental health needs and addiction needs of our community right now, by coming together, which is what the Central Florida community does so well, we can start pushing out those resources. As I indicated, we have a line of which people can call. We've also pushed out some resources through AspireHealthPartners.com hub, which are 28 videos for our community about how to cope, how to deal, and where to get services. With regard to suicide, the suicide prevention curriculum and awareness absolutely needs to be out. The sheriff is right on target that if we don't get ahead of this with prevention and helping one another with more mental health and addiction resources, that level is likely to increase.
It's great to know that the folks with Aspire are there to help out in this, not just a physical impact, because of course the virus hits us physically, but boy does it hit us mentally, even if we don't ever catch that virus, correct?
Correct. You're absolutely correct. And I appreciate you all showcasing this because it's very important for our community.
Absolutely. We are here. That's what we're going to try to do throughout the process. Thank you, Babette. We'll talk again soon. Coming up, we'll hear from the CEO of the Mental Health Association of Central Florida. That's next on Spotlight. Welcome back to Central Florida Spotlight. Joined now by Candice Crawford, CEO of the Mental Health Association of Central Florida. I want to thank you for being with us today. And when I say with us, I mean we are using the best we can with technology. And you did a great job setting up your camera for us. We appreciate that. As we go through this really has become the new norm, but we are out of normalcy. What kind of impacts are you seeing with the Mental Health Association of Central Florida?
Well, it's been certainly a different way of doing business, and for the staff, it's been different. We're doing everything remotely, so it's been a training, an adjusting, trying to find new ways to do everything that we normally do from the office. They've adjusted very well, so it's been a new day.
Really, telemedicine, that may be the best advancement that's come out of this. We knew that telemedicine was coming, but it's been thrown at us. And I would think in the mental health field, it has been effective because you are reaching people that are vulnerable without having them to get into a car and maybe fearful of, you know, that whole ordeal. Has it been better? Have people been more open when it comes to this?
We're actually reaching more people than we ever thought we would, because they're able to connect with us from much further away. They don't have to fight the traffic. That is a fear a lot of people have in coming to our office from really even in the Central Florida area. So we're really reaching people that we haven't been able to reach before, and it's really a very good thing. They're very comfortable using telemedicine. We're getting people, our number one contact mechanism now is texting.
Mm-hmm. And what about the professionals that are providing that care to the individuals? Do they feel like it can be as effective, whether that's texting or in some format that we're discussing this right now with you?
Well, there are some limitations. And when a clinician is trying to connect with a patient, they do need to be able to see the patient. That's really important. And as long as they have some good visual, I think they're finding that it really works quite well. And I really am impressed with how well received it is by the patient. And I know some clinicians have been reluctant to do it this way, but once they do it, I think they get very comfortable with it.
Yeah, this week we're really focusing on the mental health of what is a physical ailment, COVID-19, that likely won't impact most of us, but the impact all of us are feeling, whether you catch the virus or not, is the mental aspect. So, Candy, what does your organization offer the community just overall, whether we're a patient of one of the clinicians or not?
We've tried to fit what the patient needs. We find services for anybody that needs help. We research in a 5-county area, no matter where they are, we will find whatever services they need to meet their needs, whether it's economically or medically or psychologically. We stay on their case until we find what they need to help them. We do not have any screening process that they have to meet any financial requirement with us. We don't charge them for anything we provide them. And if they can't pay for services, we will stay and research until we find a service for them that either they can afford or that we can get for them at no charge.
It's just fantastic. Your organization, the Mental Health Association of Central Florida, the fact that you can help people, you don't charge people, and if the person that's going to provide them with whatever that service is does charge and they can't afford it, you also help them navigate that as well. So I would imagine people watching today are saying, okay, how do I get a hold of you or your organization because I or someone in my family or my friends need help?
You can call us at 407-898-010, or you can go online to our website, and you can email us. We're at www.mhacf.org, and all of our contact information, we have Facebook. You can call us, go online, get our texting information. You can reach us in so many different ways. On our Facebook, you can find our free group sessions that we have on Zoom and Skype, just like we're doing here today. We have multiple opportunities that we offer that are no charge on our group sessions. So we're just opening up new opportunities every day. We have meditation now and yoga online. So we are trying to help people navigate this strange situation that we're in today.
All right, thank you, Candice, for your time and for your team's effort during this difficult period that we're all going through. And remember, if you need help or you need to reach out to someone, there is someone you can talk to at any time. It's a simple phone call. You can call United Way's 211 number, which provides callers help with a series of issues, including mental health concerns. I want to thank you for watching today. We'll be back next week with another edition of Central Florida Spotlight. Stay safe and, of course, as always, take care.